Hi, John. Welcome. How are you?
I'm doing good, thank you. How about you?
I'm doing well, thank you. Today's a big day. It's an important day, and I'm glad that we've reached this point. Um, so it'll probably be the last time you hear me go through these rules, but again, I just want to remind you because this does count as one of our sessions, even though it's our final session. I just
Hmm.
want to remind you that I'm a mandated reporter. As you know, if you share anything about possibly hurting yourself or others, um, I have to report that, or also, this meeting is confidential. I don't see anticipate having to share anything with my supervisor, but in case like it's needed or it might be used for like just general evaluation of our work, they might look into it, but it's what I write down is just journal notes. I can definitely remove your name from it.
Okay.
Also, on your way out, you'll receive all the information that I've discussed during our times, like all the resources, links. I'll be sending you an email as well with all the stuff that we've covered, just so you could have it all together in one place. And yeah, well, so for today, like I mentioned, it's our last session. We'll cover a few things. The first thing we'll just do is just um check out your progress, discuss that, see how you're doing there. You've been able to practice some of the things that we've covered in here. Um, we will review some scores from some of the screenings that you've done and just make sure that you're set with any goals, any plans, a safety plan, stuff for you to follow after you're done here with us. Okay?
Okay, sounds good. Thank you.
Okay, and I am a bit congested, so if I sound nasally, I do apologize. Hopefully,
Mm.
um, I sound good on your end.
No, you do.
Okay, thank you. So, um, first things first, how are you feeling about this being our last meeting?
I feel good. I feel a little bit nervous, but I think it's normal. I think I'm ready, to, work on my own. And we worked for a couple of months already, and I learned so much. And we have, like we talked about before, with my support and all that. So I think I'm ready. I know I have some resources that you're gonna provide me and the things that I've learned. So I feel confident. I feel good.
Yeah, you've definitely come a long way.
Mhm.
It's normal to feel nervous. We're moving on to bigger, greater things, and I think you're ready. You've learned a lot. I really appreciate you, being committed to this, always attending, having that good communication with me, um, reaching out to me as you've needed. So I'm definitely glad that, we've reached this point. I do feel that you're ready. And so, just so you can kind of I could also see where you are. And again, it's nervous. It's fine to feel nervous. I think I'm feeling
Mhm.
nervous too, but it's fine to feel nervous. And because it's just probably because the change, but you're definitely ready. And you've learned a lot, so I'm proud of you for that.
Thank
Okay.
you.
So on a scale of 1 to 10, with 10 being super anxious and one being not anxious at all, where would you rate yourself with your
Mm,
work and the presentations that you do?
I think overall, I've been feeling like around a 4.
Okay, so
Yeah.
you're more
Not, yeah, I'm more in a calm. I've learned that, just making myself worry more with my negative thoughts is just gonna affect me more. So, um, I think currently like around a 4.
okay, that's good to hear. Yeah, I know that just speaking to you from last meeting, you that number has been getting better, and
Mhm.
so I'm glad to hear that you're at a 4 now. Okay. And so, like I said, we're gonna just compare a few things. So when you first started, you were my notes say that you were like a six before, or you were definitely a lot more on that nervous versus not nervous side.
Mm-hmm.
And I know that like back then, you also had some other things going on with you that indicated that you were feeling nervous, like just like the outbreaks on your skin, the sweaty palms. Um, and I think if I remember correctly, last meeting we discussed how you no longer come out sweating from those meetings.
No, it's a great feeling. Usually like we worked on before, I usually know when those meetings are gonna happen. So I prepare myself. Sometimes I take a quick walk, that way I could do my breathing, my deep breathings in my office, or I take a walk and I do meditation and positive self-talk, and then I go in there and I feel better. I feel great. I even have the confidence to um ask my supervisor now, like after, like, how do I do? Um, like, what do you suggest me doing if I could improve? I mean, don't get me wrong, I still get nervous, but I just don't feel my heart racing like I'm gonna pass out. I
Yeah,
don't sweat like before with my clothes would get, um, it would be really bad. But now I just feel more confident um with the skills that I've used, and I feel great.
that's
I
good
feel
to hear.
like yeah, I feel like another man.
That's definitely good to hear. And it also sounds like you're more confident, not just in how you feel out there when you're presenting, but also more confident in asking for feedback
Mhm.
from your supervisor and engaging with your supervisor regarding this matter. And also in like the stuff that you do to care for yourself. It sounds like
Yes,
that's really been working out for you and you've been um committed to that.
definitely. I overall my life has improved significantly. I feel like, my work environment has improved. I even feel more social, more happy. I feel like I could say good morning to everybody now as I walk in, and before I was so nervous because I was afraid to be judged by others. I was afraid that, I was not going to do my best job. But, like I feel great. Like I'm more social. I have more friends at work, and my life overall has improved with outings and social. I get invited to parties, which
That's
is
good.
great. Yeah.
That's good. You're definitely a changed man, and I think it's because of all the work that you've put in. Again, you've been engagement has been good,
Mhm.
attendance, your participation, your willingness to practice these skills, not just in your workplace, but also at home.
Mhm.
So, it's definitely good. I'm hearing that, you're socializing a lot more, you're interacting more with like your peers and your supervisor. But how are things at home with yourself?
Good. I continue to have my short schedule for the week that we developed together. I have it in my living room right there where I could see every day when I, leave the house and come in after work. Um, and usually, I take out the trash. I, wash dishes, prepare dinner, wash my dishes after. So I have a schedule that I follow and I stick to it. And my house is cleaner when my family comes over for a barbecue or my buddies from work. Like it's just better environment. I feel more secure as well because my home is clean. Um, so yeah, I've been doing that, and then just been more social. I feel like the breathing, the deep breathing, the meditation, the journaling with changing my negative thoughts and changing them to more positive and just learning my triggers. I think yeah, that I grown tremendously, and I feel like I said, I'm another person. I feel so grateful for you for your help for these couple of months. Um, I'm just comfortable. I don't know what else to say.
You're definitely a different man. And I'm proud of you. You've done like a lot of work, and it's really shown through all this time and now, and there will be and there's still a lot more things that will come your way.
Mhm,
But I think just getting having this like anxiety off um
mhm,
will help you, like you said, like now you've made more friends. That means that you'll have a better support system, not just in your personal life, but in your social life. And some of those people might cross over to the more personal side, so that's good. And
mhm,
then with your career development, I know in the past, like you haven't doubted your abilities or like
mhm.
your qualifications. It's just more of your the way that you present yourself. So I think now that it is, we're crossing this barrier, um, I think you'll also have a lot of more positive changes in your career. So that's definitely good to hear. And that's exciting. And
Yes.
that's something that you've been really working on through this. And I think that maybe treating your anxiety, um, as you've seen, has also led to other things changing. So I'm definitely proud of you and being able to make these changes.
Yeah. Yeah.
So we've said that the chore chart has worked out, and um and you're hitting a lot of highs, but do you have a plan in case you reach like a low point, or say something doesn't really work out, or say that you get you have to like present somewhere else, because with a
Mhm.
lot of this um changes that you're doing now, like they might ask you to do a bit more, which is part of your career development as well. So do you have a plan in case you become anxious again?
I have thought about that, and I think using, the same interventions that are the skills that I've used, but I know if the environment changes or I'm sent somewhere to give a conference or some,
Yeah.
larger audience, I think I would be nervous, definitely. I think my support system would be there for me. My boss would be there for me. So I would have that encouragement and just trying to control my anxiety, my stress, my nervousness, and do those interventions and just be positive. That's all I can do. I can't do anything else.
That's good. And I think with like all that positivity that you have, um, just like in the past, you had like those um little like pep talk moments, or like those like journal entries and writing down different stuff. I think that's something that can be elevated. Like maybe next time you can continue to write down all those positive feelings, or have try to keep that mindset whenever you're encountering difficult situations, so you can keep that going and just keep, because it is like a change of mindset that we have to try, and that
Hmm.
you've worked on and that you're doing now. So I think to keep that going, it's definitely going to be like a good time,
Hmm.
just because it's working out for you. Yeah, so
Yeah.
I just want you to be ready in case like something doesn't, it may seem like it's not going so well.
Okay.
Yeah. So with the chore chart too, like for example, that's something where um it serves like as a visual. So that's something that like you could try doing with like the other activities that you do, with like saying
Mhm.
like maybe Monday I'll do some journaling, or Friday I'll clean up my work area um to reset myself, or like maybe like Wednesday I'll be um going outdoors somewhere um in my backyard, or finding a nice park, something
Mhm.
like that, where you can practice like your deep breathing. So just again, just like the chore chart, maybe like you could also do something for your other days, or so you could also have that visual and be on that path of continuing um these tasks and this these activities that you do now.
Okay.
Okay. So in the beginning, during your evaluation, you completed a questionnaire. This was called the GAD-7.
Hmm.
On there, you initially scored as having moderate anxiety. That was like the category that you fell in.
Hmm.
And earlier today, you completed this activity again, and so it shows that you have minimal anxiety,
Hmm. That's great.
went from moderate to minimal. So that's um, you are really a different person,
Hmm.
and the score still wasn't at a zero, but you've definitely come a long way. And having this kind of like anxiety could be, I think it could be considered something else now. It just could just be um like nervousness, or it could be, it's not associated to those feelings of fear that you had before of being judged, of doing something wrong up there, having those physical symptoms that you had
Hmm.
before, like even your skin and the red bumps that you were getting it
Yeah.
figured out. So I think there's definitely been some drastic changes because of all that you've been able to do and just the commitment that you've had with all of this.
Yeah.
Yeah. Yeah. So, let me see. So you've said that you have your friends, you have like your family, you have your supervisor that all for part of your support. You know how to do some relaxation techniques like the deep breathing, the journal entries, cleaning your space, really being organized with yourself like at home and like the tasks that you do and also at work.
Hmm.
Um, is there anything else that you would want me to note or that you want to try?
No, I think everything's working out perfectly. What I'm doing now, I think it's working, and just continue doing what I'm doing now.
Okay, so are you ready?
I'm more ready than ever. Yes, I'm ready.
Okay, you're definitely ready. But again, I'll be providing you with all those resources so you could have. If you ever encounter a crisis situation, I've also included some information on what to do there.
Okay.
There's different mental health hotlines. There's law enforcement if it also gets to that point. But again, all that information will be in the packet that you'll receive and also in the email that you'll be getting. And then also if you need, you could always return to this service.
Mhm.
Maybe we could try something out like monthly versus what we've been doing now, or however much time like you might need.
Okay.
Yeah. Okay, so how was the session? Not too bad, right?
No, not too bad. It was good.
Okay, like I said, you're definitely ready. You've come a long ways, but um, it really is all because of you and the engagement that you've had and the
Hmm.
work that you've put into this. I'm really proud of you. Mhm.
Thank you.
Okay, well, my contact information will be there if you need it. Also, like I said, all that other information will also be there.
Okay. Well, thank you so much.
All right, thank you, John. Take care.
Bye bye.